The striking global, Indian and local data on fatty liver disease need close scrutiny. The estimated global prevalence of NAFLD among adults is 32%, with males 40% and females 26%. The prevalence is 55.5% in patients with diabetes and 7.6% in children. In 2019, there were estimated 1.66 billion cases of fatty liver disease worldwide. Prevalence is highest in Asia, Middle East and South America, and lowest in Africa. About the burden of disease in 2019, fatty liver disease caused 1.35 lakh incident cases, 1.23 billion prevalent cases, 1.34 lakh deaths, and 36.2 lakh disability adjusted life years called the DALY. Here, I must say one DALY represents the loss of equivalent of 1 year of full health. The mortality of all causes was estimated at 12.6 per thousand per year, cardiac specific mortality 4.2 per thousand per year, extrahepatic cancers at 2.83 per thousand per year, and liver specific mortality at 0.92 per thousand per year. Fatty liver disease is the leading cause of liver disease worldwide. Among those who died from liver disease, fatty liver disease is the leading cause of death. The global prevalence of NAFLD is forecasted to reach 55.4% by 2040. The most common cause of death among patients with NAFLD is cardiovascular disease, with patients twice as likely to die from cardiovascular disease than liver disease. The increased risk of cardiovascular disease in patients with NASH appears to be beyond that conferred by the shared risk factors likely related to systemic vascular endothelial dysfunction, pro-atherogenic dyslipidemia, myocardial remodeling, and heart failure. A meta-analysis of 34,000 patients with NAFLD revealed that 65% increased risk of developing both fatal and non-fatal cardiovascular events. Cancer-related mortality is the second leading cause of death in NAFLD patients, ahead of liver-specific mortality, which is far higher than the general population. NAFLD is now the third most common cause of HCC in the United States. However, NAFLD is also associated with increased risk of non-hepatic malignancies, particularly colon cancers. India has a special status regarding the prevalence of fatty liver disease. This is related to two risk factors rampant in our community: the prevalence of prediabetes, diabetes, and metabolic syndrome among adults in India is around 20%, 15%, and 30% respectively, and is increasing in both urban and rural areas. India is often referred to as the diabetic capital of the world, with 80 million diabetics. The estimated pooled prevalence of fatty liver disease among adults was 38.6, with males at 39.4, females 30.4. The average risk group at 28.1 and the high risk group at 52.8%. Urban 40% and rural 29.2%. The estimated pooled prevalence among children was 35.4, non-obese 12.4, and obese 63.4. An estimated 168 million children with fatty liver disease are in India alone. In patients with fatty liver disease, the most common cause of mortality in those without cirrhosis is coronary artery disease, whereas in those with cirrhosis, liver-related deaths are expected. Thus, cardiac deaths in India occur across all grades of fatty liver and could be the cause of sudden deaths often reported in our community. Considering the burden of fatty liver disease, the government of India has recently integrated into national program for prevention and control of cancer, diabetes, and cardiovascular disease and stroke to target early diagnosis and management. However, translating this goal into reality is a huge task. The prevalence of prediabetes, diabetes, and metabolic syndrome is exceptionally high in Kashmir. Major changes in the population's lifestyle have been related to binge eating, sedentary habits, and socioeconomic status. Obesity and overweight are common in children due to intake of soft drinks and junk foods and spending time on mobiles. About 1/3 of the population, both adults and children, have fatty liver disease. The prevalence of fatty liver disease is more than 60% in patients with diabetes, obesity, and overweight. NASH with liver fibrosis is commonly encountered in clinical practice and forms substantial proportion of patients evaluated in GI practice. Cirrhosis caused by fatty liver disease is a major health problem and presents with portal hypertension, liver failure, liver cancers, and liver-related deaths. Cardiac deaths in adults are common in this population and conferred by shared risk factors like systemic vascular endothelial dysfunction, pro-atherogenic dyslipidemia, myocardial remodeling, and heart failure. The prevalence of several cancers is on the rise in Kashmir. Fatty liver disease and NASH are a definite risk factors for several cancers, including the colon cancer.